Nice. Yeah, so we will also be introducing ourselves again. Sue Shim. I'm a social worker at Anna Robert H. Lurie Children's Hospital. And in this session, it's going to be on mental health for affected adults processing a new diagnosis. And we're going to, so grateful to be here, honor and privileged to work with leukodystrophy patients and families. So nice to have Joanne here, who's going to share her story and her journey. And you'll see the wonderful Sarah again. And we're going to be talking a lot about building our toolbox, building the team and who to include or exclude and put boundaries, more community resources dedicated to adults, navigating the challenging relationships, and then putting those self-care positive practices in place. Yeah, so here's me. Jill might remember these photos because she used to work at Lurie as well. But we have this giant whale hanging from our ceiling. We collaborated with a lot of the museums, and so there's interactive exhibits throughout the whole hospital. Our genetics division sees all ages from birth to adults. And here's some self-care strategies I put in place. My dog, Maisie, the corgi, as well as I love finding new hiking paths and read books, and just some of the things I do for self-care.
And I'm Sarah Stoney, the social worker at CHOP. I have both a bachelor's and master's in social work, and I have been with the Leukodystrophy Center since its inception in 2015. That is my dog, Dexter. I'm a total Swiftie. It's part of my self-care plan. And also, I love gardening. We were talking about other self-care habits at the end of last session, but gardening, rewatching shows that make me laugh, I think are all things that kind of bring me joy. So I have a privilege to introduce Joanne, who's going to be talking with us today and sharing her diagnosis story with us.
Hi, I'm Joanne, and I was diagnosed 19 years ago now. So it's been a long road. Thanks for the ULF's support. They've been wonderful throughout it all, making sure I get to be where I need to be and talk to the people I need to talk to. And I recently, well, I shouldn't say recently, it's been a year now, really retired. I was, for 7.5 years, I ran the local food pantry. And so that was a wonderful stepping off point after working in the medical field for a very long time. And so I'm now just kind of catching up on all those things that I didn't finish.
To get started, I just want to acknowledge that for those of you who have stayed in both sessions, there's going to be a lot of overlap. So if you're like, that looks familiar, although these quotes are different, believe it or not, there are different quotes. But like I said, but Sue said earlier, these are actual things that people have said to us, that said, my family tells me I don't look sick. If I get told one more time to cut out sugar, different things that are just so egregious and not helpful, is certainly things we hear even from our adult patients.
Mm-hmm. Yeah, and Joanne, at this point, do you want to tell a little bit about your story?
I guess I could jump in here.
Uh-huh.
Okay. I was diagnosed, as I said, at the age of 46. And what brought me to that was I started to do a lot of falling. And actually, with my history, we found out that I started falling with, probably my late 20s. And so then it just continued from there. It really kind of gave a good push in my mid 40s. And I was really having a hard time with that. Goodness, I was diagnosed and then went on to see a number of different doctors who had absolutely no clue, not a single clue. It was pretty upsetting to go to see them. And finally, my primary neurologist sent me to the Strong Hospital in Rochester, New York, who then sent me down to Kennedy Krieger. And I went down there and got full exams, did the whole route with them for over a few days. And it was just amazing to have somebody who knew what was going on so they could tell me what I could look forward to. Um, there was also a lot at that time that they said, oh, women don't do this, women don't do that, they don't get this, they don't get that. So it was a real growing lesson for all of us. And I will never forget. Um, I was able to start my process with Dr. Moser. And I went in to talk with him. And so we talked for a few minutes. And I think maybe 5 minutes into the meeting, he looks at me and says, so how has this changed your life? And I lost it. Totally lost it. I just started sobbing because nobody had ever asked me what the difference would be. So here I am as I'm a mother, I'm a wife, I've worked for 30 years, and nobody thought that it would ever make a difference to me. But he did ask, and that was just mind blowing. So from there, I got into a couple different um, oh my gosh, the word just went right out of my head. Couple different testing scenarios that lasted a few months each. And so I just told them, I said, look, I'm this age now. I can't do anything. You can't do anything for me. I can't do anything for me except just continue to get back on the bike and keep going. And I just said, whatever testing needs to be done, test me. I have I have so much that I have already done in my life. And if I can do something different for any one of these kids, please run it through me, test it through me, and we'll just kind of go from there.
Thank you so much, Joanne. So I talked prematurely earlier. Do you want to go over?
Yeah, so we talked about the toxic positivity of all help is not necessarily, helpful. And so, these are actual quotes of the patients and families have actually said to us, that was, actually did not sit well with them. It was not helpful. So just, as you encounter healthcare providers or community members that are saying things that are not helpful, is being able to put up boundaries for yourself and also surrounding yourself with people to support you and replenish you.
Okay. So we have another toolbox.
Mhm.
So this one looks a little different than our last session. So we're going to talk today about really finding that balancing act, because as an adult getting diagnosed with leukodystrophy, the priority list and the to-do list looks much different than when you're in the role of a caregiver. So today we're going to cover, building your team, community, financial, and employment resources, navigating the healthcare system and connecting with your disease community, as well as building resiliency and going through the grief process. And lastly, we will end on self-care.
Mhm. So as we talk about building our team, as I was preparing for this talk, one of the family members told me, please tell everybody to get therapy right away. And, some patients and families will ask us, like, when is the right time? But it's so important to establish with someone so that you're working with somebody in the beginning and it not only individual, but it could be couples therapy, it could be family therapy for siblings, patients, so that when the crisis time comes, you'll have these coping strategies that you have developed, and that you'll have supports in place. So in addition to the therapist, there's so many more members of the team. And you remember how important it is for sibling support. In a session earlier on siblings, Sarah led, they talked about the concept of a glass child, that a sibling might feel invisible. So much attention is being made to the identified patient, and how important it is, as caregivers to also acknowledge that time for that sibling during COVID. I've had situations where before the vaccines, parents would forbid that sibling to go out with the fear of them bringing home, the COVID infection. And so just really being very careful in looking at the whole family system and putting supports in place. There's also in the community support so many wonderful organizations. Somebody said music therapy and art therapy has been so supportive, and including them in their team, religious and spiritual communities, chaplains. And so just there's so many creative organizations and groups. Is there some support that anyone in the audience wants to talk about or that they've observed? Go ahead. Mm-hmm. Oh.
Some of the things that were on your previous.
Oh, wonderful.
Awesome.
Oh, okay. Would you like to join the ULF and become part of our supports? Yeah, no, that sounds wonderful. Any others? Maybe like we talked about gardening in the previous session, and we had at one time a horticulturalist where we can work with like kind of recreational therapy and build like plants or decorate them with cool multicolored rocks. But
Mhm. And I think the other reason that we talk about like building a team per se is because, particularly as an adult affected by leukodystrophy, you're wearing so many hats. So you're wearing the hat of caregiver often, you're wearing the hat of employee, of mom, of dad, of friend or daughter or sister or brother. And it's really good to have, not just one, but a team of people to be able to be there for you in a variety of different ways. Okay. So talking again about community resources, so the disease-specific organizations, again, there are so many to name, but Joanne actually just said something to me that I think highlights why community resources are so important and disease-specific organizations is to truly tell people that they are not alone. That Joanne had shared with me that when she connected with the ULF, that was one of the first things that she felt. And as an adult, getting a rare disease like leukodystrophy can feel extremely isolating because when you are trying to explain your new diagnosis to your coworkers, to your family, to your employer, a lot of people haven't heard of leukodystrophy and they ask you a lot of questions, and then you become the teacher and the explainer. So having organizations that can understand that perspective and understand that unique burden are incredibly important to your overall well-being. And don't worry, adults, there are wish organizations out there for you too. So people who are familiar with Make-A-Wish may know that Make-A-Wish grants wishes to kids with progressive illnesses from age 2.5 to 18. These are organizations that provide wishes to adults with progressive or chronic illnesses. Do It for the Love is actually one that I work with a lot that I love. They're music themed wishes. So you can like go see a concert or meet an artist or go to a Broadway show or hear a symphony. It's like all very music based, and they do a fantastic organization. They do a fantastic job. The other organizations just don't have age limitations. So again, excellent resources. And you just talk about, we mentioned before that wish granting, particularly when we bring it up with patients and families, is often like, that's the last thing it's on my mind right now. I've got so many other things, but I just like families to know about these things and that they exist, because you never know when it's going to come up, when you need some respite, when you need something to look forward to, and you need to have an experience for you and your family that kind of just takes you out of the day to day.
Yeah, and having a leukodystrophy diagnosis, or if you're a family member, one's definitely going to come with financial concerns. And so, being very, knowledgeable about your state waivers, applying for Social Security disability, that could come with not only monthly checks, but Medicare eventually, after 2 years. Also, there's so many new charitable grants and nonprofits popping up. And so being aware of these helped some of my families as a social worker, um, you know, uh, not be evicted from their, home, or there's been like utilities or other expenses that have come up, or their cars breaking down. So these charity organizations have been very generous of providing support. There's definitely a lot of equipment needs, and uh, not only for like wheelchairs that take so long to come, but like adapting your vehicle to accommodate wheelchairs. And so there's different organizations statewide to help with these. And when I was talking to Joanne, prepare for this, she mentioned that like equipment was very much a hurdle for her to have access to. You want to say anything more about that, or?
No, I don't
Okay, okay.
Okay. All right. So also, just knowing or navigating what's going to happen with your job and your career can be very daunting and overwhelming as someone who's newly diagnosed with a leukodystrophy. So it's tough to know, like, what are my protections? So some things to consider is to know things like the Family Medical Leave Act, or Family, or FMLA as it's referred to, the ADA, or Americans with Disability Acts, that allows you to have specific accommodations at work. Vocational rehabilitation is available, and it's called something different in every state. Has like a different acronym, but any vocational rehabilitation program is funded through the state that can help with ensuring access to the workplace when you have physical or cognitive impairments. And also just flexible work options. Now that it's 2024 and we've all gotten used to being able to do some remote work, the possibilities are more endless than they ever were before, being able for companies to appropriately make accommodations that are needed. I have something in here. This is very social work of me, on ABLE accounts, because I really do like to make sure that people are aware of just resources and information. If you've never heard of an ABLE account, it stands for Achieving a Better Life Experience. Why an ABLE account is so wonderful, particularly for adults with leukodystrophy, is because ABLE accounts are self-driven. So previously to ABLE accounts, when you had let's say that there was a child who had intellectual or physical disability and you wanted to save money for them, you would start a special needs trust. And special needs trusts are great, but they require a board and a lot of red tape and a lot of approval in order to access the money, and it's constantly third party managed and overseen. ABLE accounts are completely completely self-directed. So an individual with leukodystrophy can open their own ABLE account. So why does this matter? It matters because the money that you keep in an ABLE account cannot count against things like Social Security and Medicaid to some capacities. So for example, the restrictions and the limits are different in every state. So I'll give the example of what it is in Pennsylvania, and I hope I'm correct. the last time I looked,
Mhm.
it was you could deposit up to $14,000 a year into an ABLE account and have an overall max growth of $100,000 in the account before your Social Security would be affected, and then $350,000 in the account before your Medicaid would be affected. So the reason that's why it's so important is because a lot of adults come to our clinic and say, I want to work, but if I work, I'm going to lose my Medicaid.
Mhm.
If I work, I'm going to lose the little bit of Social Security I get. And
Mhm.
it's really difficult to try to find a job that only pays you X amount of money. So ABLE accounts answers that question to some capacity. I think that they could do better in terms of how much money they allow into the account, but with strategic planning, I think that there is a way to utilize that as more of a savings account so that people can actually build equity and that people with disabilities can actually work in the workforce. So if you don't know about them, the ABLE account websites all are actually pretty interactive and pretty helpful. I definitely suggest just looking into the program that's available in your state. And their money, I should have said this, they're money market like competitive accounts too. So you can actually make some pretty good interest and stuff like that off of them.
Mhm. So in terms of navigating the healthcare system, there's a whole culture of medicine, right? So there's different color lab coats people wear. When you go in, they say radiology instead of x-ray, right? And so it's learning all this new terminology and how to navigate successfully. There's so much language with insurance navigation, right? And benefits. Um, and so definitely reach out to, your healthcare medical team, your social worker, case manager, so that they could help you, assist you along the way. Joanne happens to have worked in insurance. Is there any other tips you have for navigating?
I don't know as I have any other tips, but just look into everything that anybody says to look into. Because you just don't know where you're going to be able to find some additional monies to cover whatever you need. I know the first two wheelchairs, manual wheelchairs that I got, we paid for. My first power chair, we paid for. And it's just, people are looking at me and saying, well, you're not sick. You don't have a problem. It's really, even though Medicare had put ALD, AMN into their listings, their medical listings with MS, it still made no difference. And I think even if maybe I had given the wrong medical information as far as which doctors to contact, I may very well have done that and not gone directly to Johns Hopkins or Kennedy Krieger. So just check out as much as you can, find out all the little nitty gritty things, and then take what you need and go to your doctors and say, can you help me with this? Because it really is so important. And let's face it, it's not easy not to be able to walk. And, so you have to have the equipment around so that you can just lead a regular life, more or less. It's just really important and be able to get out there. Gosh, conversion vans now are almost $100,000. So it's really important just to do whatever digging you can do to support what it is that you need.
Go ahead.
How did you stay resilient despite digging and getting, doors shut on you?
Just, I don't know, part of me just says, no, maybe I was just too darn stupid. I didn't realize after I worked with the medical field for 30 years, I still didn't realize there was so much more out there and so much more support that I could get. And it was just, it just happened. And thank God my husband and I were both working well and making enough money to be able to support a lot of this. But holy cow, we're both fully retired now. So I'll be doing a lot more looking.
Also, we could build toolkits with the right language to fight against insurance companies. And, if some of these things are coverages that you're entitled to, is, advocating and getting that out there on the ULF website so that there's power in that information. No, we need to create them. But I know some, other organizations like I work with also the metabolic genetic committee, and there's to get medical food coverage, which could be very expensive. And there are like, codes that you could use to get insurance companies to cover. So we need to be able to, create these toolkits.
Just to piggyback, actually, the quote from the last slide from Schumacher, I appreciate so much because it's an article that talks about insurance literacy and how that really matters so much. And quite frankly, no one goes to school to learn. Well, Joanne, obviously, no one knows this stuff generally. There was a study done and I didn't include it, so I can't, I don't remember specifically where it came from, but a review of a specific medical institution's electronic medical system was reviewed, and there was approximately 80% of the medical billing that had gone out was incorrect. 80% of medical bills that went out were incorrect. So it's such a disproportionate that quite frankly, like having medical illiteracy or not being equipped, knowing things like terms, how to advocate for specific charges, how to know whether or not you should be getting charged. Those things truly can end up in the long run costing someone thousands of dollars if they don't have access to the right information and the right knowledge. So we talked about this, but learning, using online resources to help with health insurance terms, even simple things like learning what a deductible is, a coinsurance, learning what some of those, what an EOB, an explanation of benefits, we all get those in the mail, those thick packets. Just understanding how to read those is even sometimes like extremely difficult. But now we live in a day and age where you can look things like that online and be able to become more educated and understand. Understand your coverage, understand specifically like what your coverage covers, and feel empowered to ask your doctor ahead of something, what is this going to cost me? Thankfully, in recent years, there's been more legislation about more transparency in medical billing. So really, it's the physician's responsibility to be more transparent as to what potential costs you may accrue before you get a procedure done or get a medication or something along those lines. If you don't have one, I strongly suggest having an insurance case manager. Talking to insurance companies can be challenging, particularly if you're not quite sure what the best direction is or what questions you need to ask. So having one single point person that actually learns a lot about you throughout time is going to be a godsend. And ask your hospital what they can take off your plate. Hospitals have case managers and social workers, and they can oftentimes help you advocate with insurance companies so that it doesn't always have to fall on yourself. But do keep in mind that you are, in fact, your best advocate.
One thing to add is one of the doctors started using ChatGPT to write refute letters of denial. And he puts in his letters, like all these trigger words in case insurance companies using ChatGPT to get things covered. So that could be also a future project we could look at is, how to incorporate using advocacy through ChatGPT.
Okay, making the most of your. Okay. So just we all are go to the doctor for a variety of different reasons, but certainly when you get diagnosed with a leukodystrophy as an adult, doctor's visits may become a little bit more complicated. You certainly, and making the most of them is by all means truly important. Sometimes people have to travel great distances to see a leukodystrophy provider. Not all pediatric centers see adults. We happen to in Philadelphia. But we acknowledge and know that the adult centers are few and far between as well. So make the most of your day. Make sure that if there's records that need to be sent, that that's all done ahead of time. No logistics of where to park. Specifically too, like if you have a handicap accessible van, make sure that their garage is handicap accessible and will allow your van. And ask like, how long is this appointment going to be? How many people am I going to see? Just try to go through that mental checklist before your appointment so that you're making the absolute most of your time. Bring questions for the physician. It's likely that every day things may pop into your head of, oh, you know what, I meant to ask about this brace or this item that somebody suggested to me. And without writing it down or keeping it noted somewhere, it's very likely that you might forget it when you go to your doctor.
Mhm.
So we talked about a lot of these things.
Mhm.
So be sure to arrive early, complete questionnaires that your physicians asked of you. Make sure that your questions get asked, all of them. They're there for you. Um, know when you leave an appointment, like what you have to do versus what the doctor does. I find that sometimes in medical care, um I'm sometimes conversations will end with, oh, okay, um Susie needs a new wheelchair, and then the conversation ends there, and then there's no direction as to, okay, well, what's the next step? Does that mean that I need a prescription? If I get a prescription, do I have to send it someplace? Are you going to send it someplace? So get very, very clear instruction from your providers as to who's doing what are you doing, what do I have to do, and what are the next steps. um Knowing what your plan is for communication with the team, certainly joining an online hospital portal, I think is extremely helpful, particularly as adults. I know we're all busy, so just being able to communicate back and forth with your doctor through a portal is awesome. And when possible, take notes or bring someone with you to a doctor's appointment that can take notes for you, so that you just have another set of ears there and you can remember information without it all relying solely on your own memory.
Yeah, and connecting with your disease community like this conference could be so powerful. I see these, newly diagnosed, patients, and then they go to their local disease specific conference. They come back, looking so excited and empowered. And so there's so many great opportunities. Joanne is now a ULF ambassador, right? And she's doing a session on the ambassador program. So such wonderful opportunities for mentorship and shared resources. But also wanting to be sensitive that not all families might be ready right away and might take some time to be ready to, join their specific disease community. But I just think it's we're gonna, more every year when I come, there's more and more resources and support programs. So wonderful to see.
And navigating changing roles as an adult with leukodystrophy looks a lot different than when you're in a caregiver role. We still encourage the same principles that still apply, open communication. So, particularly when you're a part of a family unit, your role has been very clear for many years, and then that may change if you're an adult that gets diagnosed. So you may change roles from being the caregiver to being somebody that requires a caregiver. Maintain your boundaries, really make sure that you're taking care of yourself and that you're maintaining the boundaries that you think are going to keep you the healthiest and that with the best mental health. Um, Focus on quality time, both with yourself and with your family, and seek professional help. It truly is, I think, the key to maintaining the most healthiest mind possible is to ensure that you have a professional involved as soon as possible so that they're with you throughout difficult times. Okay.
The grieving process with a disease like this is sometimes very difficult to even know what you're going to be doing because, well, just very simply, you're not sure of what it is that you're feeling. You know, there's a lot of things going on. You know that you're sad. You know that you're maybe depressed. Just a lot of very difficult things going through your mind. I found it very funny. A few weeks ago, I was reading a book and it was about a disabled policewoman. And there were two sentences there where she just kind of said, gosh, all of a sudden I realized that it wasn't that I was unhappy with the fact that I could no longer do my job. I realized I was grieving that I couldn't do my job. And it hit me like a ton of bricks. I said, oh my gosh, I had so many plans for when I was in my 50s and 60s and then 70s, and that may not happen. But I'm just dealing with everything that I can at this point in time and saying, okay, we're just going to do it. And thank God I have some wonderful support. And of course, the ULF is always there for me because I have pretty tight connections with them. But it really comes down to many times just kind of looking at what it is that you're feeling and being able to recognize what it is so you can get back up the next day and do it all over again and hopefully do it a little bit better than you did yesterday.
Okay.
Yeah, so we talk about taking care of yourself and self-care, and there's so many different creative ways to do this. Not everyone will go up and do yoga while doing mindfulness meditation, right? We had a big discussion the previous session on gardening and all the, growth and regeneration that comes with gardening, as well as you get to eat the fruits of the labor. But yeah, so anybody want to share anything they may do for self-care that they like to share with the group? Dancing to a Swiftie music? Uh-huh.
Mine's kind of weird, but clean.
Oh, okay. I've heard that. Uh-huh.
It's the meditation. It's
So good. Yeah.
yeah, but they have. I like to do
Yeah, that's a good one. Mhm.
Yes.
Oh,
this. Works for me.
uh-huh.
Yeah.
Wonderful. Yeah. Hey, you in the end, you get a clean house.
Yeah.
Clean house and you feel better. What'd you
Clean
say?
house can resolve a lot of stress.
Yes.
Yes,
Yeah.
yes. Uh-huh. Great. Anybody from that side? Yeah. So yeah. So anyway, there could be very creative. One person would tell me they like going through car washes, and so that's really like this cleaning
Really
theme.
creative.
Yeah. So, and there's a special like meditation poem they read,
Oh.
after they go through the car wash. So, but yeah, find the thing that works for you for self care and build it into your repertoire. So,
Mhm. So going back to just simplifying as a healthy mind is really just trying to figure out what in your life brings joy and what depletes joy. So if you think about it like a math equation, really thinking about what is it in your life that is replenishing and depleting my energy. And this, by asking yourself this question, it gives yourself permission to say no to the things that you feel like really do rob you of some of those moments of peace, particularly when it's that helpfulness that creeps in, that you can give yourself permission to say, like, actually, I'm good. I'm not going to go out with that person tonight, or I'm not going to take that phone call or that meeting. Um, and really understanding that you want to embrace the small amounts of positivity that you can and bring in as much joy as you can, even if it's small. So we've talked about that self-care does not always look the same from person to person or day to day. And these are So we talked about this in last session, these positive health practices.
Yeah, so there's, whenever, and this is exactly what Sarah said in the last session is, when you go somewhere and you start crying or you get upset, you may get handed this list of these self-care practices, right? And it's also finding the specific ones that work for you. And sometimes that takes some time to do that, right? To find what resonates with you. But um, there may be ones that develop over time that you didn't have initially. Um, and community support could be also one that really could be very powerful.
And it can be different for every person. Like, and it can be as small as listening to like a very specific song that just plucks on a chord that at a moment when you need it. It could be something very simple or some sort of tradition, but whatever it is that brings you joy, you also don't have to justify it to anyone. So whether you're cleaning your house or, dancing in your kitchen, honestly, just cherish those pockets of peace because they're very, very valuable and really crucial to getting a diagnosis like this, especially in adulthood.
Yeah. Oh, sure.
Something that I found really meaningful for me, and this is kind of out there a little bit, but start noticing when something small happens and just say, hey, thank you for that. And you probably have read a lot about gratitude journals and really holding it up and giving it forth, but just all of the little things that you wouldn't normally see because you're not looking for them. But hey, look around once in a while. And it's a really good chance that you're going to find something, and then it's going to lead to something else, and then to something else. And you just start seeing all these wonderful things that are happening around you. And just say, hey, thanks.
Yeah, there's I don't know if you guys have heard of Dr. Lori Santos. She's a psychology professor at Yale, and her happiness class has been like the most popular class in the history of Yale. And she puts gratitude, finding moments of gratitude as one of the things. So thank you for sharing that. Other questions for you guys as well as in the chat?
Yes, I do have a comment from Zoom.
Mhm.
It reads, hi, I'm back. This is the woman from the last session. Sorry, this is more of a statement, but as an adult with a leukodystrophy, one that is ultra rare and the only gene that was passed from mother to son is isolating. Also, being there isn't a lot of doctors in my immediate area, it's very hard. The closest doctor I can find that's familiar is 5 hours away, and she's not even equipped with a full team that can handle all of the possible complications. With my particular leuko, the only other ones that see adults are further. I was late diagnosed only because of my son's diagnosis with genetic testing. Passing my leuko to my son was a hard pill to swallow. I get comments, well, you're still here, you're not badly affected, I'm sure he will be fine like you. But I suffer with bad mental health that even meds are not working. I use social media like making videos on TikTok and vlogging our journey and advocating and talking to my podcast to help. Also plugging into information and support groups. I'm glad my son has a doctor now, but I'm also scared if he makes it to adulthood.
Wow. Yeah. I think this is the same person who logged into the previous session, and I have her contact to reach out to individually. But yeah, no, it sounds.
I think it also kind of echoes what we talked about in the very beginning, which is why, it's tough to talk about mental health in adults with leukodystrophies without talking about concrete resources, because it's truly what brings on a lot of the stress and anxieties that some of our patients experience and feel, being 5 hours away from a center or not having access to things, or really just living in the isolation of having such a rare disease. that we hope by, kind of approaching it all,
Mhm.
ensuring that there's connections in the community while also learning how to take care of yourself, we feel like is the best plan for someone's mental health.
Mhm. Yeah, but we will reach out to you and help you research some resources in your area.
Yeah.
Uh-huh.
So working with that, progressive, sometimes we'll encounter people who are sort of hesitant to participate in community-based things, whether it be support groups or that sort of thing, because
Mhm.
they're worried about seeing sort of their future. Do you have any suggestions on how to navigate that?
Yeah, and I actually hear that it's actually a fear I have sometimes when I'm making connections. Um, Particularly if that's a fear of someone's, I would ask as many questions as possible in terms of finding out from the group facilitators, can you tell me, like, does this cover a specific range, like newly diagnosed or, you know, more stable disease or end of life disease? Sometimes support groups can break it down into different areas like that. Um, the other thing is to ask questions about, what type of content and information is shared throughout the group. Because if it's more like resource sharing, that may be a little bit more digestible than perhaps something that's fully focused on emotional and like sharing feelings. So that's like another suggestion that I would have. Um, and particularly if someone's experiencing that, I think even like leaning into they why that would cause anxiety, is a good way for some self-exploration, and uncover, certainly, we talked about the grief process, but the realities of, wow, it could be really overwhelming for me to see someone who potentially could look a lot like me in a couple years. Just that acknowledgement and that realization could be a very healthy process as well.
Mhm.
I have a couple of questions. For first, like a logistics one, how would somebody go about getting an insurance case manager?
Just call the insurance company and say you want to be assigned a case manager. And if they argue, particularly like if they argue with you or say you can't have one, um you should argue that like that there's because of the rare disease,
Mhm.
they should be eligible for one because you're navigating much more of the healthcare system than the typical person.
Mhm.
And then, so working with people who have the disease and also may be passing it along to their kids with autosomal dominant. I find a lot of people struggling with those changing roles, going from, being a mother who may have been a single mom caretaker for their entire life, now seeing not only are they progressing, but their children may be progressing and they're feeling this guilt because of the genetic aspect of it. How do we, as professionals in the field, help support someone who's going
Mhm.
through a triple whammy?
Yeah.
It's so
No.
big. Yeah.
Yeah, no, I know I rely on my genetic counselors too, because that comes up quite a bit in, the genetics clinic and, you know, um, I don't know if Jill, you feel comfortable saying anything or?
So I was a genetic counselor when I
Uh-huh.
was student.
Do you want the mic?
Sure, I guess it would be an online thing, and I'll just make a disclaimer. This is unrelated to my current work. So I would say kind of the biggest thing is just hearing them and acknowledging a lot of the challenges. And I think one of the biggest things that I always kept in mind in clinical practice is the fact that you can't take that guilt away. And this idea of trying not to take it in a top positive spin and just being there and being supportive and making sure that they have the resources in place and other individuals to talk to, that a lot of my old patients used to share, having other families that could relate to them was helpful in at least feeling heard in that guilt that they're they're experiencing, and also normalizing that that is very, very common in genetic conditions. So it's really hard though. Absolutely.
It's really beautiful. I love that kind of normalizing it, like, you know.
Any other comments on the virtual? Oh, do you want?
I have a daughter. She's 6 years old. She have I said I forget the name of she had leukodystrophy. So we we live in Nashville, Tennessee. She have insurance. And the insurance, I mean, the doctor sent to us to Minnesota to a treatment. But I believe this treatment is the insurance. They don't want to prove the treatment. So what can I do in this situation?
So did
Fight.
yeah. Okay.
Oh, sure. So fight and argue. You know, with both your local team and the team at Minnesota, they're very used to getting told no. They usually get told no more than they get told yes. So they are the experts on how to explain to the physicians that are at the insurance companies that make the decisions as to why it's critical. The only thing I would say is that oftentimes that stuff is very time sensitive. So just get your physicians on board, including all of your docs at all of your centers, so that they can write letters, they can do peer to peers, and hopefully get the denial overturned. But just keep fighting and use the medical team, because oftentimes like a peer to peer is often just the doctor at the insurance company talking to a doctor from the institution. And oftentimes when you just get them on the phone, a lot of things we find are just denied for almost mistakes in letters of medical necessity or because of minor errors or human error. And oftentimes it just takes a conversation in order to get something like that changed. So we should connect, but definitely I would say keep fighting.
Yeah, and later on after the session, if you tell us the condition, we might be able to connect you with the disease specific group, even within ULF, so that you could also.
Diagnostic 4 months ago,
Okay.
and she started to be different now.
Mm-hmm.
So it's why I'm here, try to find it out, try to get more information about it.
Yeah. Thank you for speaking up and coming today.
Okay.
Yeah.
Thank you.
Okay. And Jill, go ahead.
I want to acknowledge, I forgot to mention something that is incredibly important, and also saying that it is never somebody's fault. And I think that is, I think hopefully that individuals understand that. Obviously, no one chooses in this situation necessarily. But kind of saying that, and then taking that next step and saying, normalizing and supporting them kind of through that.
Any other comments or questions or? Okay. Well, thank you all, and get some snacks. I saw some cookies earlier and some good coffee. So
Yeah, thank you guys so much for coming.
yeah. And Make a Wish is coming at 4 for anybody who wants to see them.